We're talking about Medicare, and specifically, we're talking about the 4 parts of Medicare. And on today's video, this is really the title appropriately would be around this annual enrollment period, which is October 15th to December 7th. So the government, when they set up the Medicare Advantage program, Part C and Part D, they had their reasons for wanting to have a limited enrollment time. And so we basically live with this for the rest of Medicare. And what it does for us, the people in the business that deliver these products to you, the consumer, is we've got all this business to do and it's jammed into about 7 weeks. So what this does to the consumers is, which is you, and my guess is what it does to you is you got all these messages flying at you starting October 1st. I mean, they're on the TV, on the morning show, on the evening news, daytime TV, if you got the TV on. Your mailbox is stuffed and full of literature, which is mostly telling you about Medicare Part C, some about Medicare Part D, the drug plans, and then a bit about why it's coming to you is because this annual enrollment period is coming up. But you also get a lot of information about Medicare Supplement, because a lot of folks are under the misconception that the only time they can mess with their Medicare Supplement is during this annual enrollment time or the fall season of the year. And that's just not accurate. So what I'm wanting to do today, what I'm going to do today is just kind of clear up all the enrollment periods, because there's more than just the one we're talking about, of Medicare and what they apply to, when they apply. So we're going to have that information. We're going to review the Medicare Part A, Part B, Part C, and Part D. And then in the later part of the discussion, we're going to talk about where you are and help you identify like where you are with your Medicare right now, whether you're on original Medicare or you're on a Medicare Advantage plan, and then what you need to do, what you can do during this season of the year to make changes in your Medicare. So that's pretty tall order, but let's get going with it. So Medicare, as you'll recall, has Part A and Part B, and it's had that since its beginning. Part A is hospital, Part B is doctor and outpatient. So most people collect most of their benefits under Part B. And Part B, after an annual deductible, pays 80% of allowable charges under Medicare. And so it's that 20% and some of the deductibles under Part A that necessitates the purchase of a Medicare Supplement policy or a Medigap plan. So if you have A and B, and then you have a Medigap plan or Medicare Supplement, you really don't need to mess with this season much. You got a little thing that you need to do. But so if you have A, B, which is the insurance from the government called Medicare, and then you have a supplement, those things work real well together. But you then need to play with the Part D business separately. And Part D is your drug plan. And the only time you can make changes in your drug plan, unless you qualify for one of these other periods, is this October 15th to December 7th. So in your Part D drug plan, you don't get that directly from the government. You get it from a private insurance company. And most of these private insurance companies that sell Medicare Advantage plans, they also sell Part D plans, okay, separate. It's called a PDP, Prescription Drug Plan. And we represent all of these companies that are listed up here. And we help people with this across 50 states and DC. So we're able to take care of you. If you live in the United States, we're licensed in your proper state, and we can do all of this stuff. But again, why I'm talking to you today is what do you need to do from October 15th to December 7th? And I'm sure that some of you are just real familiar with, my buddy Joe Namath, he's on the TV constantly putting out messages about Medicare Part C. Okay. And, I'm just kind of wondering is what does Joe Namath really know about Medicare other than being a consumer himself? But his messages have been good because they've raised awareness of this thing, but they also create just a little bit of a frenzy. And so that's what I'm trying to clear up with this video a little bit. So this annual enrollment period only affects things below the line here. This doesn't really have anything to do with original Medicare Part A and Part B, from the sense is if you're on that directly. You need to do nothing, and you don't use these enrollments to sign up for Medicare. This is purely, the annual enrollment period is purely about Part C and Part D, which is what's the abbreviation. There's tons of acronyms in this stuff that make it even more confusing, which is an MAPD, Medicare Advantage Prescription Drug Plan, which is a combination of Part C and Part D. And so if you're already on one of these, then you can just stay on the one you're on and you don't need to do anything if you're happy with it. But if you're on one of these things and you're not happy with it, or maybe you're medium happy, but you just want to see what else is out there, this is the period of time where you can evaluate your options. You can look at the other alternatives, and if you wanted to make a change, is like if you had Humana and you want to go to Aetna, or you had Aetna and you want to go to the AARP UnitedHealthcare plan, you could call us, write into us during this period of time, and we can show you the options and show you everything on both. And then if you want to make that change, we can do it for you. And the change will take effect January 1st of 2022. So everything that you change, or which you can only change your Part C and your Part D, is going to take place during that period of time. Now, so that's one situation, is you're already on a Medicare Advantage plan and you want to look at a different Medicare Advantage plan. You can do that during this period. The next place is if you're on original Medicare, Part A and Part B, and you have a supplement, and you have a Part D drug plan, and perhaps your supplement has gotten expensive. And so you're thinking, because one of the advantages of going on Medicare Advantage is you can dump your supplement. In fact, you have to dump your supplement. But you also dump the $200 a month premium or whatever that is. Now, I'm not recommending this just blanketly for people, but if you wanted to get on a Medicare Advantage plan for the first time, or for a second time or whatever, and you're on a supplement and original Medicare, you can do this during that period of time. Also, if you're on original Medicare, Part A and Part B, and you love your supplement, it does well, it's affordable, but you're not maybe that happy with your Part D plan that you selected, and you wanted to look at Part D plan options, possibly compare the Medicare Supplement, you might be surprised that there's something more reasonable available for you. This is the time of year to do it. Okay? Now, then you could be on a Part C plan, MAPD, you're covered under C and D, and you could just say, I'm not happy with the whole system. I used to have Medicare Supplement. I went on this Medicare Advantage plan. I'm not satisfied with it. I want to look at my options to go back to original Medicare. And I want to go back on, well, I'm still on B and A, but I'm going to get my coverage from there. But before you do that, you're going to need to investigate a supplement and a separate Part D plan. And we can do that for you right over the phone. We can send you a text for the forms or an email. We've got this pretty well down. Now, what I want to get across is there's 4 enrollment periods. So it's not just October 15th to December 7th that you can make changes in your Part C and Part D. There's 3 other enrollment periods. One is called the open enrollment period, and that occurs every January to March. So you just think, well, I don't have to do anything during the frenzy. I can just wait until January, February, and March. Well, possibly. But this is a very limited deal. By that I mean you can only make changes if you're already on a Part C MAPD. And if you're on that during this period of January to March, and you want to change to another one of these, you want to move from here to here or here to here, or you want to take it and you want to go back to original Medicare and then buy a supplement, you can do that, what is called the open enrollment period, January through March. But if you're already on original Medicare and you just want to consider Medicare Advantage plans, you can't do that. You have to already be on one of these things, and then you wanted to make a change. Now, the third type of enrollment period is called the initial enrollment period. These are, for the most part, these are the people turning 65, or they're the people, like if you're one of these folks that you delayed your start of Medicare Part B because you continued working past 65, and now you're going to be starting Medicare and Medicare Part B, you have an initial enrollment period based upon your starting of Medicare Part B. And what's unique with these other plans is they're going to start effective the next month. With the annual enrollment period, all coverage changes start January 1st of the year. Now, the fourth one is what's called a special enrollment period. And what that is if some certain life event has happened to you that makes you eligible now to buy a Medicare Advantage plan, to go from original Medicare onto a Medicare Advantage, or to get off of a Medicare Advantage plan and go back to original Medicare and buy a supplement, they have a thing called a special enrollment period, which can be any time of the year. And this is if you get divorced, if your spouse dies, if you move to a new zip code, or out of the service area of the plan that you have, if you retire, if there's a disaster and a storm in your area that affected your enrollment things, there's a whole bunch of reasons that a special, and we can counsel you on this. So if you're watching this video during the year and you think that you might qualify for one of these things, we can help you with that, and we can tell you, and we can actually make the enrollment for you in all 50 states and DC. So what I want to do is transition now from talking about positioning the enrollment periods to what we're going to actually do for you and educate you on what your options are. And so this board looks somewhat similar, where, you know, it goes over Part A, Part B, Part C, and Part D. So it's the same business, hospital and skilled nursing. The Part A comes at 0 monthly cost for most people. The Part B is your doctor and outpatient that pays 80% after a deductible. Your monthly cost that many times comes out of your Social Security check is $148.50 in 2021. And you also, for you high income people, you got this IRMA thing to deal with, and you'll just want to look up one of my other videos on that where we talk a bit about IRMA, but Medicare gets real costly if you have a high income in retirement. Then it's the same business, is that if you're on original Medicare, or you were on original Medicare, and then you elected to receive your Medicare from a private insurance company like AARP, UnitedHealthcare, Humana, Aetna, Cigna, Blue Cross. So if you made that election and you now receive your benefits for Medicare from a private insurance company, you're down here covered under Part C, and most Part Cs include a Part D drug plan. They just throw that in to the mix. And you say, well, boy, you got me confused already. Well, you got in the beginning, there was Part A and Part B. That's all there was. And then there were supplement plans to fill in the gaps, or a Medigap plan. And we'll talk about those in a sec. But about 15 years ago, they started this program called Medicare Advantage, and they created another part of Medicare, which is Part C. And it's just the government is taking you being covered under Medicare, and they're paying for you to receive your Medicare benefits from a private insurance company. And you've elected, if you're on this, to allow them to do that. And they're throwing in the Part D plan just for good measure. Now you say, well, why would I want to do this? Well, number one is you don't have to pay a Medicare Supplement premium. So, I mean, that is a big motivation, is that people, in fact, you can't have a Medicare Supplement. When you get on a Medicare Advantage plan, you can't have this. Now, you say, so that's one reason you'd want to do this. The other reason is you get extra benefits on these things like dental, vision. That's a lot of what Joe Namath is talking about. He's really, a lot of times on these commercials, all he's talking about are these extra benefits. He's not giving all the explanation behind the scenes, and that could be a gym membership. Many of those include those. Some of them have food plans. Some of them give you some bit of a rebate toward this $148.50. So there's lots of good reasons to get on one of these things, a Medicare Advantage plan. But let's also talk about, why would you not want to do this? Okay, and the biggest reason people don't want to do this is the networks of hospitals and doctors, is you're going to be then limited to a certain network that you can pick in advance. So if we're offering this to you, we can check about 7, 8, 9 different companies. And then with each one of those 7, 8, 9 companies, they've all got about 3 or 4 or 5 plans. So if you know who your doctors are and the specialists are in one clinic, we can get you into the right Medicare Advantage plans, that this won't be a problem for you. You just use that network. It's very similar to what you have for coverage when you're under 65 and you got regular health insurance, where you have to deal with a network. But people that are on Medicare and they stay on original Medicare, they don't have to mess with networks. I mean, they're going to be any doctor that takes Medicare and accepts Medicare anywhere in the United States, you can go to them. And that's the disadvantage to this, or the networks. Or another way to put it, that's the advantage to this, is the freedom to go to any doctor or hospital that you choose to go to. Okay? Now, another disadvantage is, or it could be both a disadvantage and an advantage, is they just throw in a Part D health plan. It just comes with your Part D. So the disadvantage of that is you don't get to pick your Part D plan. You just get whatever comes along in the MAPD or in the combined plan. The advantage to that is many of these Medicare Advantage plans are zero premium. I mean, where you pay nothing for them, because the government is paying the private insurance company money behind the scenes on your behalf. So that's just a decision that you'll need to make personally. If you elect not to do that and to stay on original Medicare, then that's where the supplements come in. Okay, and so you're on original Medicare Part A and Part B, and your deductibles and co-payments are large enough that you're going to need some supplemental coverage to go along with that. Medicare all by itself, or Medicare naked, it's not a very pretty thing when you have a serious illness and you're having to pick up 20% of the bill without a cap on it. And so with the Medicare supplements combined with original Medicare, people just rave about the coverage. They got to pay for it, and they got to buy separate dental, and they got to, there's some things you got to give up, but yet people after they get sick are real happy when they have this and this put together. So now let's talk about these Medicare supplement policies. I mean, we do this business year around, by the way. So you can make a change in your Medicare supplement 365 days a year. It doesn't matter whether it's March, October, June, any time of year. You could do it more than once in a year. Typically, people are going to change Medicare supplements every couple, 3 years. So in other words, if we just wrote one today, or another way to put it, if we wrote one back in 2018, and many of those people are evaluating them in 2021, and they're seeing what else is out there, and it can save them $20, $30, $40, $50 a month to change over to one that's charging less for exactly the same thing. We do a lot of that all year long. So if you're watching this video during the year, it started out talking about Medicare Advantage, but if you're interested in doing something with your supplement or getting one of these supplements, we can do this for you anytime. Now, the supplements, we could do an hour-long show on just supplements, and we're not going to do that. We're going to save that. There are 10 different standardized Medicare supplement plans available to you in 47 states. There's also Minnesota and Wisconsin and Massachusetts, 3 states that don't use these lettered plans. But so the other 47 states, I'm going to make this simpler, is the G plan, G like gum, offers the highest level of benefits. And the difference in price, in my opinion, and what you have to give up to get one of the lesser plans like an N plan or a D plan or something like that, it's really not worth it if you shop for this stuff. Now, there's some people that will sit with you and they'll only show you one company, and they'll show you how this N plan or G plan saves you so much money it's worth giving up the stuff that you have to give up. But we have the advantage of looking at 40 companies for price for a G plan. Most of the time we can find a G plan that is so competitive it's pretty close to the N plan. So for the purposes of this, we're only going to look at G plans. But what I want to get across is I've just listed 6 companies up here. And these 6 companies, Aetna, AARP, Mutual of Omaha, Humana, Anthem, Blue Cross Blue Shield, and Cigna, and I've listed them in 4 different states purposely, and I've listed them for a 70-year-old male who's single or doesn't qualify for a household discount and the Plan G. And so this is exactly the same policy in this state, and the state listed, as all the different companies charge. So, and I've used North Carolina, that's my home state. I'm in Durham, North Carolina. And as we told you, we work all over the United States, 50 states and DC. But, I'm looking here that Aetna right now for this particular person, $118 a month for a G plan. So you look at that. That could even be discounted if he was living with another adult. But then you go down the list and you got Blue Cross Blue Shield in North Carolina charging $159 a month for exactly the same thing. So if you're on Blue Cross, you have a G plan, you meet these criteria, you could save $40 a month, have exactly the same coverage by just changing to Aetna. I also have this up there for illustrative purposes to show you that there's some pretty significant variance, because there's some down here over $200 a month selling exactly the same thing. Now, I've got California, Florida, and New York. California is at the higher end of the middle of the pack, or the lower part of the pack. Still not terrible, but if I go in California, the least expensive G plan for this dude is $164 a month. Now, actually not, that's correct. Anthem, Blue Cross, is $157 a month, but you could pay as much as $200 a month if you bought Aetna, which was the lowest one over in North Carolina. So it's important to shop this stuff and not just be, it's important for us as agents to remain open to showing all the options to people, and we'll do that with you on a phone call. Now, I get over here, Florida. So in Florida and New York are on the more expensive end. So if you live in Florida or New York and you elect to go this original Medicare plus Medicare Supplement, and you do this because you want to be able to go to any doctor you want to go to, then it's going to cost you. Okay, but it's still important to shop, because we can look here. Mutual of Omaha is coming in at the best rate in Florida. And I've gone to the most expensive zip code in Florida. So there are some people, that's down in the South Florida, down in the Miami, Fort Lauderdale area, but it's going to be less if you're in Orlando or you're in Tampa. So, but anyhow, just it's not going to be that much less. $303 a month for Mutual of Omaha. And if you just bought from whoever showed up, Aetna is, I think, the highest there, followed real close by Cigna. And then you go to New York, they're even more expensive. Well, actually, AARP is going to give you a bargain on this at $278 a month. So kind of giving you the spread of the whole country. Most of the country, if you're not in one of these states, is going to be closer to the North Carolina rate or somewhere between the North Carolina and the California. And there are a few states that are actually less than North Carolina. So, I mean, we can run that for you if you give us a call, and we can even email that to you. Now, if you have Original Medicare and a Medicare Supplement, you're going to need a separate Part D plan, and we're back to this open enrollment. We can't do these 365 days a year. We're stuck in that window of time. But if it's during the year, we're doing this for you. We can certainly get all the information and just tee it all up, and then we can do the Part D drug plan when the fall rolls around again. So if you all want to get in touch with us, we've got this 7-week window where we're going to have to serve. We got 5,400 clients. So you can imagine if we had to talk to all of them, I mean, we got our work cut out for us. So if you really want to reach me directly and you're watching the YouTube channel, you could just send it to Hans, H-A-N-S, at cardinalguide.com. That's my email, comes right into me. You also can send a text to this number. This number will accept texts. And if you want to direct it to me, you can direct it to some of my staff. You can email into me, or you can just go to cardinalguide.com, and there's a messaging capability on there. So if you want, if you want service on this, you could go ahead and just tell us a little bit about yourself, and we can communicate by digital, or you can just call in. I mean, that's the old-fashioned way, and we're going to do our best to serve you calling in. We answer our phone during business hours in the East Coast time, and we're going to do our best to serve you. So some of you, you'd rather do that. It's a little more anonymous. It's all fine. I'm just telling you, if you want to get to the top of the line, you send me an email, I'll respond to it. So I thank you very much for listening. I'm Hans Scheil.